Welcome to the Seco Direct podcast. As we have done over the past couple of weeks, tackling different issues regarding eye health and everything around that. Today, we're going to talk about a particular ailment that affects a lot of people all over the world. It's called glaucoma. What can we do about it? What are the types? How does it come about? In this episode, we're going to dive into exploring that much more finely. We hope you enjoy. My name is Dr. Tiwa, and welcome to the episode. So, what is glaucoma? Well, typically, what glaucoma is called is usually described as the silent thief of the night. So, why is it called that? A lot of ailments that come and with age are usually things that progress over a long period of time. So, when we talk about glaucoma, this usually progresses over a long period of time without it being noticed. By the time it gets noticed, that's when we realize that there is significant damage that has been done. That is why we went into making sure that we do eye tests regularly. If you go through our previous episodes, we've spoken about doing yearly eye tests. So to prevent or know this, to know that your eye is progressively going through these changes, you need to do that. So what exactly is glaucoma? So glaucoma is a group of eye conditions that damage the optic nerve. In our eyes, we all have this water that passes through our eyes that maintains our eyes regularly. So that water in the eye passes through what is called like a canal to enter our blood system and goes around the body. So as you age, that water that helps maintain the eye does not find it easy passing through that net that helps it go into the blood. So when you age, as you age more and more, as you grow older, that mesh, the water would not readily pass through. So if it keeps stopping after a while, the water doesn't all go through to the blood system. Instead, it starts to accumulate. So once that water starts to accumulate instead of passing through, it increases the pressure of the eyes. You see it like this. If we have a wall and a car keeps trying to pass through that wall or pass through the hole in the wall, if the car is not the exact size to pass through that wall, it stays there, causing a pileup. And when there's a pileup of cars behind it, there is more pressure in that hole to go through. That is what glaucoma essentially means. It means the water that maintains the eye, that usually helps your eye health, is not able to pass through well. So because it's not able to pass through well, it accumulates and also then causes increase in your eye pressure. So now there are several types of glaucoma, but the ones we're going to focus on, or we're going to shed light on in a deeper way, is the open angle, which I've explained, and then the close angle. So the open angle is what I explained, with it being something that goes on and on over time. Now, when it comes to the closed angle, you know what I said? There's the water in the eye that helps to maintain how the eye functions. So when there is a sudden break, when there's a sudden break in that activity, that is where we get our secondary or closed angle glaucoma. Now, glaucoma is very age related. The most common types of glaucoma usually occur when people are at least 60 and above. So apart from this age related cause of glaucoma, there's also family history of glaucoma. Certain ethnic backgrounds can also cause you to have a high propensity for glaucoma. Like, for instance, if you are African or African American. And then also conditions like diabetes or high blood pressure. We've discussed about these topics before as to how if you do not do anything to curtail or do anything to stop these things from progressing, then they usually affect other parts of your body, including the eye. So if you have some conditions like diabetes or high blood pressure, you would also have a high tendency to get glaucoma. That is why we at Seco Direct always speak to making sure you have regular, comprehensive eye exams. That is completely crucial. If glaucoma isn't age-related, like when it's not something that comes with how you age, we have what is called a congenital glaucoma. This is usually present at birth. You know, when I said there's water in your eye that helps in the maintenance of how your eye goes, we have what we call a congenital glaucoma that's present at birth. So when that water is there but is already accumulated at birth, it affects your optic nerve. So that optic nerve is the one that helps with how you see. So at that congenital glaucoma, there is improper development of that water passage. You see, that water that helps regulate your eye, it passes through a drainage system into your blood system. So if it doesn't drain properly at birth, that's when you have congenital glaucoma. Another form of glaucoma is secondary glaucoma. So that secondary glaucoma is related to the closed angle glaucoma. Like I said, it's just a sudden stop of those drainage systems. Can be caused by tumor in the eye, for instance. If you're using medications such as steroids, if you had like an injury to your eye or like an inflammation to your eye, there's this popular ailment of the eye called Apollo, in quotation mark, which is conjunctivitis. So that could also cause or facilitate having those things come faster, having glaucoma come faster for someone. So this is when there is not an age-related glaucoma event. So how do we diagnose and manage glaucoma? The key, as I've always said, is early detection. We as Echo Directors have always spoken about comprehensive eye checks, comprehensive medical checkups of your body, but also your eyes, very importantly, your eyes. Regular eye exams are essential, especially if you're a high-risk group, as I've mentioned. If you're above 60, if you maybe know that you have hypertension or diabetes, during your eye exam, you can inform your doctor that, okay, you know what, I have this ailment that I'm managing effectively with the drugs that I have, and I want to just know what is happening with my eyes. Can you measure the pressure in my eyes? Can you measure whether the water that maintains my eyes is draining properly? Can you tell me if the angle of my eye is adequate? Can you tell me what kind of damage has happened to my optic nerve that helps me see? Because I'm seeing that my eyes are blurry. Just make sure you're very plain, true with your doctor whenever he is, checking your eyes. Because it's very essential to make sure that your doctor understands what he should be looking for. Doctors have been trained to look for these things over years. But if you tell them these things, you tell them how you two are on top of your own health, they are able to know, okay, this person is really, serious about their health, and they know exactly what to look for when you talk about the conditions that you have or how you have been feeling. Now, if this is diagnosed early, if your glaucoma is diagnosed early, it can be managed very effectively. Medications have been known to manage this very, very well. Laser treatments and surgeries have been known to also manage this very well. So it's not the end of the world with regards to having glaucoma. The goal of these treatments, of course, is to lower that pressure. Like I said, that pressure doesn't come if water doesn't accumulate, or if water is draining properly. If water is draining properly from your eye, it won't accumulate beside that drainage and then cause increase in pressure. You understand? So these treatments are to make sure that that drainage system passes well. Living with glaucoma it could be really challenging. It's difficult to have a certain way you look at things for most of your life, and then suddenly your eyes start to become blurry. You are not able to see things as well as you should. But I have to tell you, with the right management, with making sure that you've gone ahead to check how far gone it is, making sure that you are playing with your doctor, making sure that you have the right support system with you as you're going through this. People have been known to have this glaucoma and live full and active lives. Educating yourselves and your loved ones as to what you need to take, what you need to do, and also the importance of having regular eye checkups can help make a difference with people around you. Whether age-related or non-age-related, glaucoma is a very serious eye condition that requires our attention. Like I said, early detection and proper management is key to preserving how you see and to preserving your quality of life. Make sure you can only do this. You can only do this through routine eye exams. Like I said, and let me give you a breakdown of how this should normally go. So glaucoma testing should occur 1 to 3 years after you've clocked 35 years old. That's for people with high risk. That's if you have diabetes or hypertension, or you have a family history of glaucoma. 2 to 4 years before the age of 40. That's from 35, like I said, to 40. You have to check your eyes at least 2 to 4 times. From 40 to 54, you can check 1 to 3 years between 40 to 54. Then from 55 to 64, 1 to 2 years. And then once you're after 65, because now 65, above 65 is high risk, is high level of risk for glaucoma. You have to check at least every 6 to 12 months. Thank you for joining us again today on Seco Direct. If you have found this episode helpful, please share to everyone. Eye health is very important. So for more insights, you can go to our comment section and drop some questions that you would need us to answer. And subscribe also to make sure that we give you more updates on how to maintain a healthy vision. Remember, your eyes are your windows to the world. Let's keep them healthy.